this morning's Business Insight. After 3 days of hearings, the issue of health care reform is now being decided by the justices of the U.S. Supreme Court. Some of them seemed open to the idea that part of the Health Care Reform Act can survive even if they strike down its core. But they asked detailed questions about what happens to the rest of the law if they determine the requirement for all Americans to buy insurance is unconstitutional. So joining us with some local perspective and the impact on the business community here is Kate Keller, Senior Program Director for the Health Foundation, and Dr. Barb Tobias, the Medical Director for the Health Collaborative. Good to have both of you with us today.
Good morning. Thank you.
The Health Foundation has filed a brief with the court. Why? What was that about?
So we submitted what is called an amicus brief, which is a friend of the court brief, to explain some local research that we have done that we thought would be informative to the justices. So the main arguments that you've heard with the Supreme Court is that people choose not to enter into the health insurance market, and whether or not the federal government can require you to enter into a market you have chosen not to. Well, through our research, we have found that people don't enter into the health insurance market because they can't afford it. It is very clear by the data that if you have income, you make the choice to buy insurance, and those whose incomes are low make choices to buy other things such as food, housing, and those types of things over insurance. So we just felt that it was important that the justices knew what happens in Ohio and Kentucky in our region and the decisions people make about their choice to not enter into the health insurance market.
Well, we have such a strong health market here. There's incredible hospitals, research hospitals, really at the upper level of health care. So, Barb, what elements of the Affordable Care Act are being supported in our community and why?
We've started the work even before the Affordable Care Act was passed in 2010 to increase healthcare quality and try to get costs in line. So the Health Collaborative, healthcare systems are working with primary care practices to implement new models of care to keep patients well and out of the hospital. We're really fortunate that the insurers recognize this and are working to support primary care providers and others along these new models of care. Additionally, we have the support of the employer community who recognizes that when we can keep costs in line and improve quality, we have a competitive advantage.
So, Dr. Tobias, then this is going to continue regardless of what happens at the Supreme Court?
Absolutely. This work started before that and will continue irrespective of the Supreme Court's decision.
But as the Supreme Court considers this, even if their decision is made very soon, it will not be announced until June.
Correct.
There's still some uncertainty involved here for business. What does that mean for business here?
Well, one of the things that we're not clear about is whether or not the employer mandate or employer requirement for large businesses to provide insurance will stay in place. So as they review the individual mandate and if whether or not they can take that out of the law, or if they have to strike parts of the law, or strike the entire law, the justices have to make that decision. And so there'll be an implication to employers that maybe if the mandate goes for individuals, will or will it not go for employers? And those are things we just don't know yet.
Did you want to address that at all, Dr. Tobias?
You know, I think that we know that our current system is unsustainable and that our current system doesn't keep individuals well. We don't empower patients to stay out of the hospital. We have a volume fee-for-service system. By realigning incentives to empower patients to keep them well in between visits and to support providers to reach out to their population of patients, we really control the healthcare costs and improve quality. We know that better care is actually less expensive. So these kinds of efforts are important no matter what the Supreme Court decides.
This is really a big part of business. I mean, especially large employers like we have here in Cincinnati. How much company resources go into providing health insurance and researching and this law? This uncertainty out there really is probably adding to some of these costs, isn't it?
You know, I can't say for businesses how much they spend on that, but it is a significant portion of their resources in order to provide health care services and benefits for their employees. So it is absolutely something that they watch carefully and track.
All right, Kate Keller, Dr. Barb Tobias, thanks for being with us today. We'll be watching this closely.